Think about the last time a prospective patient walked out of your consultation room without committing to treatment. You had the clinical expertise, the technology was flawless, and the financial package was competitive. So, what was the missing link? In many cases, it isn't the medicine or the price, it's the lack of a psychological match. A practice is ultimately only as successful as its ability to truly connect with its community. We often treat patient comfort as a soft skill, but as clinical leaders and entrepreneurs, we must recognize it as a primary driver of case acceptance and long-term compliance. In an increasingly diverse world, a one-size-fits-all personality approach at the front desk or chairside is a massive missed opportunity for your practice efficiency. Some patients instinctively prefer a practitioner who mirrors them, someone who shares their cultural nuances, their communication style, or even their pace of conversation. When a Spanish-speaking patient feels that immediate bond with a clinical assistant who shares their native language, the baseline anxiety of a complex procedure drops instantly. Others thrive on a contrast in perspectives, valuing a dynamic energy that differs from their own. By strategically assembling a diverse team, you are effectively increasing your surface area for patient connection. This is a core pillar of lean management, reducing the friction of the patient journey by matching the right personality to the right patient. When a patient feels truly understood, their satisfaction and cooperation skyrocket, which leads directly to better clinical outcomes and a higher retention rate. This intentional matching turns a simple appointment into a customized, high-trust experience. But diversity goes far beyond what we see on the surface. It includes how we communicate and, crucially, how our employees expect to be managed. In a modern urban clinic, you may have staff members from cultures that favor flat hierarchies and open dialogue, working right alongside those who are more comfortable in a traditional, patriarchal style, where the boss makes every single decision. If you try to lead a team member who expects firm, top-down direction with a purely autonomous, hands-off approach, you won't be empowering them. You'll be creating profound anxiety and inefficiency. They may interpret a lack of explicit, detailed instruction as a failure of your leadership, resulting in decision paralysis and process slowdowns. A true, lean leader understands that leadership is not a fixed template. You must adapt your style to these varying professional backgrounds to reach operational excellence. This means knowing exactly when to offer high-touch mentorship and when to enforce a strict, documented policy. By doing so, you ensure every team member feels secure and empowered within their specific role, which maximizes their total contribution to your practice goals. This flexible approach means knowing how to offer security to some while giving freedom to others, ensuring everyone is moving in the same direction. Now, we often think that changing the energy of a practice or breaking a cycle of stagnation requires a new hire, but that's a misconception. Teams are dynamic organisms, and as a leader focused on optimization, you can give a stagnant team a new impulse simply by strategically switching people between work areas. Think of cross-training not just as a backup plan for sick days, but as a sophisticated internal audit tool. When you move a clinical assistant to the lab or an administrative person to a coordination role for a few weeks, you are challenging set-in-the-ways thinking. An administrative team member viewing clinical workflows with fresh eyes might instantly identify redundant forms or unnecessary handoffs that the clinical staff has become blind to over the years. This temporary reassignment forces the entire team to articulate, question, and ultimately improve old habits and workflows. This level of flexibility is a hallmark of practice efficiency. It allows you to test hidden talents while keeping your team's lean eye sharp. It upskills your employees, making the practice more resilient, and it exposes the bottlenecks that have become part of the wallpaper. This cross-functional insight is one of the most effective ways to drive profound, low-cost process improvement without ever running a recruitment ad. Your task as an entrepreneur is to ensure that this diversity results in excellence rather than confusion. When managed correctly, diversity is your engine of adaptability. It prevents your organization from developing a narrow perspective that fails to see incoming market shifts or evolving patient needs. When you have a broad group of personalities and backgrounds, you can serve a wider range of your community more effectively. This variety ensures that your clinic isn't just an office, but a vibrant, adaptable organization that can handle any challenge, from language barriers to complex financial situations. A practice that actively mirrors its community becomes deeply rooted, making it recession-proof and a preferred destination for both talent and patients. This proactive engagement transforms the practice into a true community health asset. Diversity provides a constant, healthy tension that, when channeled by effective leadership, sparks superior solutions. By intentionally composing your team to include a variety of ages and perspectives, you move from a state of simply repeating old patterns to a state of constant, proactive innovation. Diversity is the raw material for creativity, and the friction between different viewpoints is the polish that perfects your processes. Use the differences in your team to benefit the patient, and you will find your practice reaching its highest potential. Thank you for your time, and I'll see you in the next video.